Excellent. Okay. So thanks for joining me. We've got a couple of people that I haven't seen in a while, so welcome back. Um, and I think I know everybody on this call, so that's great. Um, and welcome anybody who's here for the first time as well. Today we're going to go over Standard 10, and Standard 10 is a kind of a, I feel like it's a combination standard. It's kind of for two different things, but it's there's some things in there that are specific to group-based programs or home visitation programs that provide group services. And then overall, the whole, what is the program's approach to parent education services? That's why it's titled Parent Education Services. So as always, we are going to discuss the differences between policy and procedure first, and kind of make sure that that's really clear for you as we go through the rest of the presentation, because we do talk about each of those separately. When we talk about policy, what we are talking about is those broad applications, those statements of what or why. Those rarely change, if ever. And typically, and I'm not saying this for every organization, but those would be board approved. So those would be those really big. Lee, do you want to mute that? I think you're talking. There you go.
My bad.
There you go. Okay, so those are typically going to be your, or those would be the things that might be approved by your board if applicable to your organization. Procedures are going to be more narrow in application. They're going to detail those specific processes. So talking about how or when, who, those are the things that might change as you get a different funder or a different funding stream. Sorry, I do see a question come in. I will get to that just a sec. They are things that might change more often. They don't necessarily need to be board approved. Sometimes programs will have like a program board or like an advisory board, and those might be things. Procedures might be something that you would run through your advisory board. There might be multiple procedures under one policy. I think that's something I forget to talk about a lot. But it could very well be that you've got three different policies or three different procedures under one policy. So one of the questions that I got here is, can a policy or procedure ever be the same? Yeah, so there's going to be some times when it's going to look very similar, if not the same, and that's okay too. I can think of, I was just talking about this yesterday with a program about a standard that, what was that one? It was 2105. We were talking about the release of information, and that standard is basically like releases of information are provided to the families when they sign it and placed in the participant's file. So like there might be a little bit more definition you need to provide there, but probably not. There's probably not anything there that you need to explain beyond what you've already got in other places about just the general release of information form, those kinds of things. So it could be that they're the same or look very similar. I'll give some examples today where kind of we try to separate it out as much as we can. Some of the things today though do kind of encroach on that, like it might just be really kind of the same. So we'll get, I think we might be able to see some of that play out today a little bit. Let's see here. And then the other thing that's really important that I want to make sure everybody is aware of is how important, and if you're not doing it already, please get those go in soon, that the revision dates on policies and procedures, especially if you're a program that's been credentialed before and you're going to be coming through for a renewal, because being eligible for an expedited renewal is contingent on this. You have to have, as a program and consequently an organization, for the organizational standards, a method by which you track those dates for when things are revised, when changes are made. Because if you're doing an expedited renewal, or if you're eligible for an expedited renewal, we have to see that. We actually have to I want you to send me examples of like what that looks like for your program, and what that system looks like. And then also in the next peer review, anything that's changed from the previous, any policy or procedure that's changed from the previous since your last peer review would automatically get included. And so we want to include those, make sure that somebody's got their eyes on them, those changes, and that there has to be a mechanism by which you keep track of things. I know. So there's a couple of different ways to do it. You could do it right on, this top example is like right on at the policy or procedure level, where it's tracked like that. It also could be in a different document, like an Excel spreadsheet, or something else that tracks it like that. I know there are lots of programs that use like formal policy software. It can be tracked that way as well. And in those cases, I think you can, print off or run a report and then share with me the report, to kind of show how that works too. But so if you're not currently doing it, and you're thinking about putting this in place, or you need to put it in place, but you have some questions on how to do it or ways to structure things, shoot me an email and let me know, and I can help you out with that for sure. And then to elaborate a bit more on the policy and procedure example. So policies are kind of like those broad picture things. And I have an example here. I don't love the example. I was trying to find something that would apply to like everybody who might be on this call. And because programs in Iowa are so, different based on what the needs of their communities are and what the structure is. But I really wanted to kind of visually represent that, like, the organization might have a big policy, and then you might have more that procedure level might be broken down by department. It might depend, each department handles something a little bit differently. So for family support programs, it could look completely different than it might look in a public health type of, where there's any sort of public health, other thing going on. Family support is very different in a lot of ways. And then it could even further be delineated out down even more based on funder. Within early childhood department, if you have multiple different programs, it could really depend on what type of program it is, whether it be one that's funded by McVie, whether it's one that's funded by local ECIs, ICAP, whatever the funding stream, there could be some specifics that you need to delineate out based on that. So yeah, I hope that helps a little bit on what that structure looks like. So we're going to dig into Standard 10 now. So as a kind of an overarching, the intent and the purpose behind Standard 10 is that educational and skill building activities empower parents and improve adult functioning. One of the things to note about Standard 10 is the standard is specific to parent education services that are provided directly by the program. So as we talk through these, for the most part, except for a portion of 10.03, we are talking about services your program provides, those parent education components of the program itself. So previously in Standard 8 and Standard 9, we talked a lot about, there were a lot of different categories in each of those. And it was like, if you provide these services, show us how. If you link, and most of them were like linking with community partners or with someone else that provides those services and documenting all of that. Like, this is very different. And so I just want to kind of first call that to everybody's attention, just because, it does go 8, 9, 10. Like, and so when programs get down to addressing Standard 10, they're kind of already in that like linking and resource connection and that kind of mode. But Standard 10 is really just about what your specific program does itself. So Standard 1.01 is kind of that beginning process for things. And it really has nothing to do with specific content or anything like that. It's just that when deciding upon or choosing or designing educational interventions, materials, and curricula, child and family characteristics are included in that decision making. So you're considering age, developmental level, race, culture, ethnicity, language, and literacy level. And then to expand on that a bit more, organizations should seek the input of families and other community members when developing those. So I'm guessing probably, I'm looking at this on my attendee list, everybody in this program or on this call is in a program that already has curriculum established. You're already utilizing a curriculum. So kind of the way that you would kind of tweak this is shift this is like, how do you know that curriculum is working for you? How do you know that it's meeting the needs of your families? How often do you review that? When was the last time you reviewed that? What's the steps in that process look like? So I know it's kind of hard to think about it like when it's like, well, yeah, we did that like however many years ago when the program first got started, but like this is that intentional, reevaluation of it. So understanding the policy, things to kind of think about here. What is important when you're considering choosing or designing curriculum? Like, obviously, look to your child at the characteristics of your children, the children and family enrolled. Definitely want to make sure you include all of those things that we talked about in there. I think that sometimes literacy level is a little bit harder to wrap into things because all curriculums are written at various levels. And so, in that way, you might want to think about, how might you use a particular curriculum with a family that had a lower educational attainment or learning disability? What might that look like? And then what groups are included in the discussion for choosing these things? How do you solicit? How are you getting the input from families? How are you getting input from community partners? The people that you need to talk to like kind of like, what are our needs? What should we be considering? What's important to us? How do you collect that? Do you do a survey? Do you get like a panel, like a group together and kind of talk through it? Like what things are important to you? Those kinds of things, like come with a plan for this part, make sure that you're intentionally and purposefully incorporating those things in the plan for your program. And then the other thing to say here about just curriculum in general and the work that the parent education services in general is that you don't have to use just one curriculum. So, it could be that you make a selection, but you recognize that, this isn't going to work for every family. And so maybe you have secondary curriculums or multiple even, and that's okay too. So as we get on into things, we'll talk a little bit more about specific requirements for content that's to be created, that's to be included in those curriculum. And so if you notice that there's a bullet that you're kind of, maybe your current curriculum doesn't fully cover or doesn't cover like how you want it to cover, you can definitely consider looking towards some supplemental areas to cover those topics. So for procedure, this is where we're going to capture, those W words. So when we think about child and family characteristics, where is this collected? Define that in your procedure. How often is the data reviewed and reconciled? Who is involved in that process? All things to delineate out in procedure. Organizations should seek the input of families and other community members. So who owns this process? This review of the curriculum. Who's responsible for it in the program? Is it the supervisor? Is it a director? Who owns that process? Who is procedurally in charge of it? How often is the input collected? So like, we're going to do this review every 5 years or whatever the case might be. Where is information collected, and then where is it documented? Have a system for, this is the file it lives in, this is where it's stored, it lives here, so that when you're getting ready to put everything together for your peer reviewers, it's super simple for you. And the next time through, next time that you're doing this process, that you're reevaluating curriculum and materials and everything, that where to put everything so that it is easy to find at your peer review when you're getting ready for that. So I want to talk just briefly on all of these. I incorporated practice in here because practice is kind of that missing piece, I think, a lot of times, like it's the aha moment. So these are the areas that you'll want to put. So the big circle here is on all of these slides, it's going to look kind of the same way. The big circle is what goes in your box. We've changed our language on that. We're calling it like the non-PHI evidence. And part of that is just it's a we were using the word box for a lot of things and it got really confusing. So we had to kind of, you know, change some language. But PHI is protected health information. So this is your box. This is the thing that you send to the peer reviewers prior to the peer review that they go through that doesn't contain any information, any protected health information, anything about families, anything about those kinds of, anything that it comes in like, you know, your participant files, nothing like that. Nothing with names or dates of birth or those kinds of things on it. And so things you want to include in there might be meeting minutes or agendas where you show that discussion of the educational intervention materials and curriculum, or meeting minutes and agenda that show that community participation where you're soliciting feedback from the community or soliciting feedback from families for those topics. It might be that you have completed participant surveys. So that include kind of things about age, developmental level, race, those kinds of all those different elements. Another thing to think about too, you know, is that data is pretty available for any of our users that use DAISY. You know, you've got your pretty much your demographics there, and so that would be something that as you're kind of putting together, like, how am I going to collect this information? It's right there. The other thing I will say, later on we talk about, there's a standard that talks about service population, and so we'll definitely want to make sure we're using the right data when addressing that. And it could be the community needs assessment. You know, there might be that there's some things that are in there that kind of highlight specific needs about the community that might help you make decisions about curriculum and intervention or educational interventions. And then this over here, this little circle, this is PHI portal evidence. This is the stuff that right now it goes in Dropbox. The programs upload to Dropbox prior to the peer review that contains those protected health information items. And so in this one, specific to the standard, it might be completed participant surveys if they had, like, you know, names or those kinds of things on it, would be really the only evidence that goes in the PHI portal for this standard. And the last thing I want to talk about, we'll kind of go through the same thing for every standard. And I know this one's going a little slower because is those common missteps for 10.01. So I went back and I pulled up all of the times that these standards have been out for each standard that has been out of adherence. And I kind of looked through some commonalities, what things, you know, did we see happening a lot? And so I wanted to use those as kind of like educational, like an opportunity to talk about what went wrong and then kind of clarify any of those things that were maybe not, that might be confusing about the standard. So the first one was like just misunderstanding the standard to mean that the family support professionals use curriculum. And they sometimes this one is like they don't see the community piece of things and the family. They think it means like customization of the curriculum to the needs of the family. That's not exactly what it means. This is that intentional planning that takes place to consider all of the different options for curriculum and educational interventions, and then make sure that it meets the needs of the service population. This isn't about just one family. The other kind of misstep would be addressing the standard by only providing a list of the curriculum or the educational materials, like, this is the list, this is what we do, but not, you know, adding that purposefulness to the approach and that reevaluation. A lot of times we kind of, it's like, well, we did this upon program inception, however many years ago, but like, so has your community changed since then? I'm guessing, or like your service, you know, even the families that you're seeing, that you're working with, maybe when your program first started there, you know, you didn't have very many diverse families, and now you do, you've been able to really outreach to them and bring them in. And so maybe that looks a little different. You need to find some curriculum that meets the needs of those folks. And so this is really, again, about community and big picture, not individual family. If you're putting together things for this standard and you start thinking about individualize, that you're kind of going down the wrong path. Just we'll individualize in standard 10, but that is the next standard, and moving on from there. Which gets us to standard 10 or standard 10.02. This is families are educated about child development and child rearing topics that include, and then we've got a whole list of them here as appropriate. And that's an important designation because not every family might need all of these things, especially, you know, your basic care routines basic caregiving routines could look very different for a newborn than it might for a 2-year-old. And so, you know, just making sure that you're not saying, okay, for every family, this is what we do, and this is our intervention with them, and we just do it on this routine. First visit is this, second visit is this. Like, you customizing things a little bit more to the needs of the family and the ages of the child, and maybe they need more about one particular topic than another, and so you're talking about that more often. I do want to talk about this standard. This standard is applicable to all program types. I get this question a lot. Like, I know it feels very home visitation program like, but it is applicable to programs that provide only groups as well. So here's where we're going to dig in on each bullet point. What are the topics of curriculum and educational materials that are used? Make sure each bullet point is directly covered. If it's not obvious, highlight it for the peer reviewers. You know, you don't want to leave it up to inference. You don't want to leave it up to where the peer reviewers have to make a decision like, I think this might match, or I think this doesn't match. Like, draw the line straight from point A to point B for them. Again, multiple curriculum or educational materials can be referenced. Most programs, in fact, do something like that, or have multiple. And usually there's a primary, but then, you know, multiple supplemental based on various needs. Educate, the word educate in the standard means directly provided by the program. Each bullet point needs to be covered. In policy, you need to spell out each bullet point in policy. Referrals for additional information may be given as necessary, but that curriculum and educational materials should cover every topic. Yeah, I don't know how to say that any more clear. I want to make sure I'm being super clear about that. That each bullet point is spelled out in policy. So in procedure, the things that you want to provide additional, like how you do it, those kinds of things, is address each topic by describing the available curriculum for that topic. This might be something where you reference like an appendix of an appendix or appendice, like where you've got like, for these topics, these are the curriculum articles or whatever handouts. For these topics, these are, you know, that's referenceable. And then as curriculum changes, you update it because it's a procedure and you can update those regularly, or change those. And, you know, or if you need to include page numbers, you definitely want to reference something. So you're again drawing that line just right from the topic to the curriculum used for those topics. You know, designate it out in procedure. I don't love writing in procedure like, for this topic, use this, for this topic, use that. I don't love that way of doing anything. I think that, you know, doing an appendix is probably a really good way to do that, or some sort of supplemental material that exists in conjunction with that procedure that talks about other things as well. Those other things, you know, might be that curriculum selection and documentation for each family. So like, where is the curriculum topics documented? Like on what form? Is it the home visit form? Where's that, you know, where's that documented? Who selects the curriculum for each visit? Obviously, that's probably the family support professional, but like, you should probably say that. How is curriculum selected? What's kind of that process? Is it like parent asked for this? So we're, you know, or do you ask for parents? Like, hey, what do you want me to bring next time? What are you interested in learning about? It seems to me like lately I've seen a lot of really great ways that programs are doing this, is that there's you know, various sheets and forms that they use, like what things are you interested in? Or like, there was one that like, on our next home visit, what would you like us to talk about? So I think there's a lot of really cool ways to do that, especially to bring families into the process, and not always are, you know, there's going to be times when you recognize a need that the family doesn't recognize a need for, and you can certainly bring those in as well. But I think there's ways to incorporate families into this that are really cool and exciting, for me anyhow, to think about. For practice, These are the items that would go in your box. Obviously not full curriculum, like total, like, I mean, the PAT curriculum is how many, literally thousands of pages. No, that's not what we're talking about. But like for each content item, so whatever you say is going to be your article or parent handouts or whatever for each content item, you want to include include the article. Don't just name the article, include the article. I realize that for some of this, it might be quite lengthy. And if you get to the point where you're like, I've hit the basics, I've hit the main ones, then I think you're good, especially on some of those curriculums that are just super comprehensive. It also would be helpful in those instances to include the table of contents from the curriculum, just so that peer reviewers can see like everything that's in that curriculum. I think that sometimes helps get at that, like, oh yeah, they have plenty of things to pick from. They definitely have curriculum that addresses a lot of things here. Also in the box would be those blank forms that are documenting the curriculum that are used. And I wanted to kind of break this out because it's really important. We're talking, this is stuff that's got to be in, just those group-based visits as well, or group-based programs as well. And so, how do you capture what topics, what curriculum are used for those groups? Highlight where the curriculum used would be documented. I know that a lot of times it's like, we're going to have a topic, like we're going to talk about child car seat safety, but like have a foundation from which that's coming, right? Like, it does, I'm sure it exists in everybody's heads. Like we know how to talk about it, but like, having something that you can give a family that they can read through, or that is that it's all based on is important. Same thing for home visits, blank form documenting where the curriculum that was used, highlight on that form where curriculum used would be documented. And then in the PHI portal, it would be, what would be in there would be those, you would upload those, whatever is existing in the participant files where it covers that documentation of the curriculum used. Some common missteps for 10.02. Really the big one here is that they're for some reason, one reason or another, each bullet point isn't addressed that's in the standard. And so if you don't spell it out in policy, and you don't draw some straight lines in procedure from like the bullet point to the what curriculum, like specific handouts, and peer reviewers are looking through files and they're kind of like, oh, I see some things about this and maybe some things about that, but I haven't seen some things about that. Like, make it simple for them. Spell it out. Again, if you rely on peer reviewers to draw their own conclusions and hunt around for things in files and like kind of make their own decisions about things, then there's an opportunity for something to get missed there. And I think that that's maybe not reflective of what's actually going on with the program, but maybe more that like something just didn't get captured in policy or procedure. And then best practices on that would be to include procedures that like staff that tell staff specific parent handouts and curriculum pages for each topic. Like that's probably like elevated, like to tell staff this is exactly what we do. But that's I mean, it's not required. But again, if I were a program that wanted to ensure that peer reviewers knew exactly what I was using for each and they didn't have to like interpret anything, that is what I would do. I would spell it right on out for them. And then the other one is that participant files don't document curriculum or topics discussed at visits, that they're not able to see in the participant file contact notes or home visit records or whatever, that those things are being specifically addressed, like what topics were talked about, what curriculum was brought, those kinds of things. All right, so we're going to move to standard 10.03. Standard 10.03 is very similar to 10.02. except for that it relates to expectant parents. It is about that educating piece. However, we do have a kind of a caveat at the bottom, an interpretation that these topics may be addressed by qualified medical personnel in the context of the prenatal health care referenced in 8.02. In 8.02, it talks about linking with health services related to prenatal care. So in programs that employ nurses as family support professionals, obviously their training allows them a bit more education and knowledge into some of these pieces, and they might, that might even be like more of the focus of the visit or the purpose of the program, but that, so basically for this standard, if your program doesn't provide that educational curriculum, like it's not, maybe you hire social workers or teachers, that it's not, health isn't like the focus of the program. And I say that, I don't mean it quite like that. You know what I mean? Hopefully. But that you can make it link, you can make sure, you just need to make sure that the families are linked to these things. So kind of, it says programs that target expectant parents are required to ensure education is provided either directly by program or through referrals to appropriate resources. Programs that do not target expectant parents are required to link those parents to appropriate resources. One of the things we hear a lot, I get a lot of questions on for this one, is like, well, we only enroll families after the child has been born, so we don't have prenatal families, so do we have to address the standard? Yep, you do. Because all of those those moms who have had children, or those families that have got children, could potentially have another child. So you might actually potentially have a prenatal parent enrolled in the program, but they're in the program because of the target child is born or whatever. So it's going to be very much the same. What are the topics? Same as 10.02. What are the topics of curriculum and educational materials used? Link each bullet point. If it's not obvious, highlight it for the peer reviewers, make it obvious. You can use multiple curriculum or educational materials. This one's a bit different in that, that word educate means provided directly by programs or linked to a resource. If the program targets expectant parents, or, that you don't provide that health topic in your program. Still want to make sure that each bullet is covered, and that you talk about each bullet in the policy, like you say, these are the things that we talk about in your policy, because if you just said generically, we included in our parent education services are curriculum topics that pertain to expectant parents. That's not it. That doesn't tell the peer reviewers everything that's in there, and it doesn't guarantee that programs hit all of those topics. Procedure, again, very much the same. Address each topic by describing the available curriculum for that topic. That would be like that best practices, like line them right up. And really that's the TA piece that Leanne and I will give you as well, is that it makes sense to put that in there. I think an appendix is the way to go. I don't know. That kind of just occurred to me as I was putting this webinar together, and I thought, that's the way I would do it. List the articles or article titles or page numbers, address each bullet. Consider, so as you go through each bullet though, think about the educational requirements of staff who you've got in those roles, what the requirements are for each position, and decide, like, is this something that we even consider providing any curriculum about, or is this something we always just refer out and link to another service on? And the other thing is that kind of that follow-up on those linkages to services to ensure they're truly connected. That you're discussing barriers to those services, that you're hopefully able to troubleshoot or problem solve some, how to overcome some of those barriers. And then that curriculum selection and documentation for those links. How is curriculum selected if you have a curriculum that you use? Who selects the curriculum? Where is it documented? And where are those links to resources documented? For the box, it's all very much the same. Actually, I think this one is entirely the same, with the exception of the referrals. Making sure you've got a system for making, tracking, following up on referrals. Checking in with families. Hey, did you access that referral? How'd it go? Did you get all your questions answered? Whatever that might look like, so that you can ensure that they really are connected. Yeah. And I think that's, I know of several of the curriculums out there, they might address some of these topics, on a very basic level. And then, if families have questions that are more in depth or like specific to like this pregnancy, as I'm having XYZ situation with this pregnancy, like if there are things that the family support professionals aren't in their area of expertise, then then you could refer out on those too. I think really all of these bullet points in the standards, like you give the education that you have or that you can, and then you still refer. And really that's for any health, probably any standard that relates to health. Common missteps for 10.03, programs just not addressing the standard fully. They say that I only work with families after they've been born. Clarification, no, this standard applies to every program type, every program design. Even if you don't directly provide those things in curriculum, you need to have a way to ensure that you're linked all of the families with all of those potential content needs. And then programs not addressing each bullet, as staff are not educated in those topics. We kind of talked through that one already, and what that clarification would be. 10.04, standard 10.04 is that parent education services promote self-sufficiency and self-efficacy by building on family strengths and addressing topics related to positive personal functioning and development. There's a lot there. And this is like the longest run-on sentence. I don't know. I don't know. It's very confusing. So we'll try to chunk it out a little bit. I think, as we look through things, I like the interpretation a lot because it gives you some ideas on some topics, and really like kind of where they're going with this. So the key words there are self-sufficiency and self-efficacy, building on family strengths. Those are actually probably the big ones to me. Addressing those topics, in ways that, or by, things that relate to positive personal functioning and development. And the standard does apply to all program types. So I think for this one, it's really that intentional work, that intentional planning into program design, curriculum selection, and then individualizing to family needs, but intentionally individualizing to families' needs. So what intentional work is done to build on strengths to address self-sufficiency and self-efficacy? What educational content do you use with families to promote these? Think about how the strengths are identified with each family, then build on that. Incorporate specific needs of the service population in there. And then again, consider these topics. And really this is where it's super meaningful for me to kind of get started when I'm thinking about it. So, your policy doesn't have to address each of these things, but as you're kind of thinking about what this might look like, your policy is kind of that broad statement that is talking about, it's the what, it's that this work is done. This is our program's approach to these things, and this is how we individualize it for families. And I think that for this one, a big component would be just that purposeful planning for each family's like visits. Making sure that, hang on here just a second, there we go. Making sure that, there's that focus on like, okay, here are what their strengths are. Here's what we can do to build on those strengths. On this one, and really a lot of these, like a cookie cutter approach is not gonna going to serve every family the best way. And so I think that if I think though the way to get at it is like that home visit planning and group planning, making sure that you've got a plan before you go. And that, I mean, Parents as Teachers does a great job of it. Of like they have documents even that you can use to fill out and all that kind of stuff. But I think that's the way to go, to make sure that you're first starting with program or with family strengths, and then addressing these topics in a way that builds on those family strengths. So be specific here. We want to talk about each piece of things. Align each topic to the curriculum or curricula used with families for that topic. And that one's like, maybe like, that's important. This is one that I can imagine you might have to, rely on some supplemental curriculums for perhaps, but making sure that you've got a solid, collection of materials that you can use on each of those topics. If you list out those article titles, page numbers, make sure that each bullet, there's no bullets on this one really, but like each kind of piece of that giant run-on sentence is covered, talking about self-efficacy and self-sufficiency. Those are big ones there. And I think there's a lot of, those words are broad encompassing statements. There's a lot of like little pieces that might fall under each of those, like self-efficacy and self-sufficiency. Self-sufficiency could be a lot of things, it could be financially, it could be, transportation, it could be lots of different things. And then self-efficacy really is, it could be related to anything as well, is that, you're feeling good about oneself to go out and get a job, feeling confident in your ability to talk to your doctor about concerns, feeling confident in reaching out for additional help on child development, whatever, it could be just so many things. And then again, how is curriculum selected? What curriculum topics, where is that documented? How are the strengths captured? And then how is that used for skill enhancement? This standard amazes me when we don't, I read the policy or procedure and I don't see the word strength mentioned at all in this policy or procedure, or I don't see anything that like tells me about like what you're using to kind of like base that communication, that conversation with families on in these topics, when it doesn't have that foundation of those strengths. So it could be like when you set goals, we talk about strengths, and so it could be that you're using some of those conversations, some of those, where you ask families like, what things are you good at, and I know a lot of times families are like, I don't know, and you have to help them come up with some items, but like, I think that's a good place for the conversation to begin on this one as well. For practice, in the non-PHI box, or you'll want to include, curriculum for each content item, blank forms documenting the curriculum used both in groups and on home visits, blank forms for family strengths that captures that, and then those completed forms that would be available in the PHI portal. Some missteps on this one. Program policy, procedure, and curriculum did not use that strengths-focused approach. And obviously we talked about that one. Or that program policy and procedure, covers everything. But then when you look at the participant files, the peer reviewers weren't finding documentation of conversation on those topics, or the conversations were not, based on strengths, or they were not positive really at all. It was really hard for them to find that consistent message of like what exactly is being done with those families. Policy looks great, everything's there, but that actual like on the ground work, what's happening there? And it comes back to that intentional planning. I really think that that's so important. Okay, so we're going to shift gears just a second here, and I realize we've only got 15 minutes left, but these go a little bit quicker, I hope. Standard 10.05, we are going to talk about groups. And so these next three standards only apply to long-term home visitation programs with a group component. So I suppose if you don't have a question for me and you don't have one of those programs, you could probably leave. I mean, you can stay if you want, but that's the rest of this webinar is about that. So when parent education is provided in group setting, services include these bullet points. They emphasize group learning and sharing, respond flexibly to the changing needs of group members, and are scheduled with participants' time commitments in mind. It would only be an A for programs that don't provide parent education groups. So if there's not a group component to your home visitation program, then wouldn't apply. So understanding this standard in policy, what does the parent education look like in a group setting? Think about how you schedule the events. Think about the needs of individual group members. Think about the facilitation and who facilitates those. What work is done to ensure that families are able to participate and contribute to those groups. So think about how do you get feedback from them? How do you know what days and times work? How do you reevaluate that over time? Think about, if you're a program, if you do a couple of different types of groups, like maybe you have a teen parent group or a new parent group, the needs of those groups of people might be different. And so how might you vary both the content and the scheduling of those groups? So for procedure, how is the family curriculum needs and schedule needs collected and considered? Who completes those forms? What forms are completed? And then that group planning, how, who, and when is group planning completed? What are the key components of group meetings? I know there's lots of different group models out there, and all of them kind of have a slightly different focus. And that's okay. That's fine. I think, and even among like different types, if you're doing a teen group, maybe it looks different than if you're doing a dad's group or whatever. So, thinking about all of those different components, making sure again that you have a plan. Not being like just kind of, we're getting together, we're going to hang out, we're going to play, we're going to whatever, I kind of wonder if that really is a group at that point, if it's just like meet you at the park, it's a play date, but is it a group? I don't know. So making sure that you've really kind of captured all of those pieces in there. What do you want to do? What's important to you as a program? What are your community needs? Family meal important. I know that gets people there. Like if I'm gonna serve a meal at a group, I'm probably gonna have better turnout. Are you going to have like community resources that come in and have a short presentation? That's I've seen that works. What does that curriculum discussion look like? If it's like a formal sit down at lecture, that might not work as well as like finding a way to talk about a curriculum, but in a way that's kind of fun. And maybe there's some activities that you bring in, or maybe you have small table discussions. There's parent cafe kind of format. And then parent-child activities. I see those I think we do a good job with those. I think I see those a lot of times. And so, what might that look like? Is it, what does the structure look like there? And how do you do that across age groups? If you've got, a parent with newborns and a parent with, preschool agers, like how do you kind of span the age difference there? So talking about all that kind of stuff in procedure, that planning and that, who's a part of that, what forms are filled out, how do you pick a curriculum, all of that. Standard 10.05, also we might be looking at those setting of group rules. So it could be rights and responsibilities. If there's a form signed or parent handbook, how do you kind of set some of those rules that are necessary for the standard, especially like that, just the way that the group works. Group planning forms, completed group planning forms, because they don't typically include protected health information. That could all be in the box, and the non-PHI box. Participation feedback, where you're asking families, what do they want? What do you need? What days and times work best for you? And then the blank supervisor evaluation for the groups. I think that's really important to make sure that there's kind of that, like, are we doing groups the way we want to do groups, in the way that we said we're going to do groups in our policies. And then in the PHI portal, those completed forms from participants and completed supervisor evaluation forms. Some actually just this one misstep here for the standard program has policy and procedure for scheduling at times that work for families and to be flexible. But when it came right down to it, what peer reviewers heard and saw evidence of was it really didn't support that there was a variety of dates or times. There wasn't surveys. There wasn't really any evidence showing that there was a variety of options, or that when the program was setting some of those things, that they were asking participants what they wanted. So in your policy and procedures, you want to outline exactly how you do that, how you collect the information, how often you collect that information, what forms that's on. How does that stuff all kind of filter into that purposefulness? Standard 10.06 is very, very similar in a lot of ways. Group programs provide participants with the opportunities to. So these are kind of like that, like what takes place during a group. Again, applicable to long or home visitation programs with a group component and group programs. So what are the fundamentals of group events? This is your policy. Think about those core objectives, key components for shared learning environments. What's important for people to learn, to learn in a group environment? It's different than learning in a home visit. And so like, what are some expectation setting that needs to maybe happen? What are some, so that might be, there's some rules, that you need to talk about. How do you plan for that? Like, what does that look like? Think about the relationship building components. What is the goal or purpose of the group when it comes to that? Like, to get families to interact with one another rather than just like in a silo within their own family. Because that, some of the standard does talk about that cross family communication and shared learning, those kinds of things. And then what contributions to groups do families have? Again, just thinking about what the group looks like itself at that event, and thinking about how that planning takes place for those group events. Procedure, when we talk about the documentation of the event itself, where is that documented? Who documents it? How is learning measured? What forms are used? All things to outline in your procedure and to cover there. I think on this one, well, really on any standard, but this one in particular, you can't over plan. I mean, I suppose you probably can, but you could put there's a lot of stuff that could really go in here talking about, facilitation and what those will look like, and outlining some things, because as planning for groups are for the success of the group, putting together policy and procedure that is like kind of that expectation, like this is what it's going to look like, is that same as planning for the success of groups, or planning for to make sure that everything goes right when you're putting a group together, so that everything goes right for when the group happens. I think that's kind of how I look at policy and procedure in general, is like, not just like, how you do your job, but also like, if we put purpose and plans into that, and we write it down on a piece of paper, we go to all that trouble, it's more likely than that we're actually going to do that stuff. And that like, when you leave as a supervisor, that the next supervisor is going to do that stuff. Describe systems for group facilitation, purposeful planning, what group rules and expectation settings done, how do supervisors review the groups or look at the groups to ensure objectives are met, what forms are used. So things that'll go in the PHI, non-PHI box, group flyers that show the topics of the groups, or that show the events that are occurring at those groups. Participant satisfaction surveys, so like blank surveys relating to those areas. Documents containing group rules. And forms, blank forms for group planning and those group meeting documentation forms. Completed participant evaluations, rights and responsibilities, completed group planning forms. I think that one actually could probably go over. If it doesn't contain family specific information, then probably the planning stuff could go over in the non-PHI portion. And then any completed group meeting documents. I think the important thing I want to say here too is that there needs to be documentation on every group, like how it went, how did it go, what went, what was talked about, and then to even some degree, there's going to be times when a particular family, you have some additional documentation that maybe needs to be done on that family. And so then you might have, even if you're a group-based program, you need to have a mechanism by which you can document family specific things. If I were to go in and look at all of a participant files for a program and saw no individual documentation about families, about, whatever, about something, I would be concerned. I think there needs to be a way to document that should the event arise. And I can think of all of the groups that I've been a part of or facilitated, and there's never been any group where I've not had something that I needed, like a conversation I needed to document independently, an observation that I had maybe about something that was going really well and I wanted to make sure to capture that, or maybe something that didn't go very well for that family, something that they asked for additional help on, that kind of thing. So that should definitely be built into the system if you're just a group-based program and you don't do home visits. Common missteps for 10.06. Group events that only focus on one thing, like maybe an activity, and then they don't include opportunities for sharing and learning among participants, listening, relationship building. We're not saying that every group has to have every component, but over a series of group events, all of those should be kind of incorporated in there. And then groups aren't purposefully planned for, including the facilitation of those topics. So like, that's just there's not any way to see that that's happening. And then groups aren't documented afterwards. So you, again, just don't really have a way to gauge as reviewers that's happening. 10.07, very quickly. Personnel providing parent education services in a group setting are available to meet with parents individually. If personnel are unavailable to meet with parents before or after, that there's some way to follow up with them other times. To have conversations. And again, this it applies to any home visit with a group component or group-based parent education programs. Super important there. This one is, I get a lot of like, is this really applicable for us? We're a group-based program, but we don't offer these services. You do though. You need to be able to at least have conversations with families individually. Now, is it like full curriculum, full on home visits, full on what? No, but like to have a conversation independently. Make sure the family is connected if there's something that they need from that. Make sure that they know who to call, and that they are connecting with that resource. So what kinds of additional supports is available for parents outside of group meetings? Are they before or after groups? Are they part of a home visit? I've seen different things there. And then what needs might families have that require some individual conversation? So we think about standard 8, think about standard 9, they might have, they need to be connected with different resources. You could also think about assessments that might be occurring, child development, enrollment information that you're collecting upon enrollment when they enroll into the group program. There might need to be some individual conversations. Some group-based programs only have somebody that still goes and meets with the family first to collect all that kind of information, to do that initial kind of like, collection of all of the data that needs to be collected for DAISY and for funders purposes. And then they have the groups from there. That works actually pretty well. I've seen that work out pretty well. For procedure, so I wrote this kind of down into 2 different things. For long-term home visit programs with a group component, documenting that follow-up conversations to make sure, that continuity with the family's home visitor. how is information shared that follow-up is needed? So if the home visitor wasn't there at the group, how would they know about maybe, hey, you need to talk about these things? Like, what's that process look like? Does the facilitator, share that with the home visitor? Does a release of information need to be made? Sometimes I think that's, even in intra-agency, a release still is probably best practices to have that filled out. For group-based parent education only with no assigned home visitor, when does that follow up? Define that in procedure. What does that look like? Who does it? Where is it documented? For practice, for home visitation with a group component, we're going to have probably in there those blank home visit documentation forms and blank releases. And that would show, again, that continuity between this group and then subsequent home visit where we talked about same content. For group-based parent education, blank releases of information, blank assessments, blank individual contact forms, whatever those items are that occur one-on-one would be what you would put in here. Any other forms that contain like specific blank or for specific individual work with those families. So whatever your program design, how that works. And then additionally, a way to like document those individual conversations that take place before or after, or during there's something that you needed to document it for whatever reason. If you don't have a mechanism to document that as a group-based program only, let me know. I can help you find help you create a form, but there needs to be something there. Group participation evaluations, and then in the PHI portal, these are all things we've talked about before that could potentially be reviewed in conjunction for the standard. We've talked through these missteps. The home visitor doesn't attend the group. There's no way to like ensure continuity of that conversation about what needs are. I think it's important to note that the group interactions might look very different than families might look very different in a group than they look in a home. So it's possibility that the group facilitators might see some things, pick up on some things, learn some things about the family that the home visitor, it might be helpful for them to know. And so what's that look like? Yeah. So standard 10, kind of our wrap up. If you didn't document it, it didn't happen. I have a love-hate relationship with that phrase, but I mean, it's true. Do things with purpose. A home visit and group planning is key to this standard. The cookie cutter approach to parent education services probably is not going to work. Making sure that you're really individualizing things per the family's needs, per the group needs, those kinds of things. That's really the way to be successful in standard 10. And then, okay, there we go. Plan to incorporate family needs into everything. Everything you do should be driven by that, what they need, and then building on those strengths when appropriate. All right, so we ran over and I apologize for that. There's our content information. I'm going to stop the recording now.